Let's discuss details of diabetes. You see, if it is between 3.88 and 5.6, it is quite normal. But one thing is important, if it is between 5.4 and 5.6, it's pre-diabetes. It's not pre-diabetes, but it's very close to. If it is 5.7 to 6.9 or 7, it's pre-diabetes definitely. And if it is 7.1 or 7 plus, it's diabetes. So this is how you can guess that you have developed diabetes or you have developed pre-diabetes, right? And the other way you can get it confirmed, that is if you have glucose 7.75 grams of sugar, and if you recheck after 2 hours and if it is 11.1, then you are definitely diabetic. And the other way you can also test this, that is hemoglobin test, HbA1c. So hemoglobin A1c, if it is 3.5.7 or less, that is if it is between 3.88 and 5.6, then you are normal. If it is the average, the HbA1c is the average of 3 months and little more. So if you have 5.4 or 5.5 or 5.6, it means you have developed pre-diabetes. It is little bit concerned. And if it is 5.7 and 6.4, then you are definitely pre-diabetic. And if it is 6.5 or plus, then you have developed diabetes. It is measured according to the level of sugar attached with hemoglobin, that is glycated, right? So if you normally have tested and if seen that it is 7, it's likely that you have developed diabetes. But to be more confirmed, if you have 75 grams of sugar and if you measure your diabetes after 2 hours, and if it is 11.1, then you have developed diabetes. You are a diabetic. And one thing here is important, if it is 6.1 or more, then it means that your body is under threat. Diabetes is disturbing your eye health, the blood pressure, it can destroy your memory. You have problem with retina in the back side of your eyes, and you may also develop dementia, Alzheimer's disease, and healing will get more difficult if you are diabetic. Immunization is compromised. Immunization is damaged in course of time. Nerve damage, and if it happens like uh, some part, the end of your finger, the end of your toe finger, leg finger, uh, suppose it's so painful, it gets a little bit problematic, like parts, something happens, then you may have to have amputated. So it's very terrible. So diabetes is not a disease, it's a metabolic syndrome, but it destroys so many things. Eyes, blood pressure doesn't stay normal, memory doesn't work that well, retina gets damaged, dementia in course of time, Alzheimer's in course of time. Your healing power is compromised, your immunization is compromised, there's nerve damage, and amputation is even necessary. So here, if it is more than 7 normally, or if it is more than 11.1 or more, after you have had 75 grams of glucose and measured after 2 hours, it means you're definitely diabetic. And if you Also have the other test, the average of 3 months, even 4 months. That is hemoglobin test, HbA1c, hemoglobin A1c. You can be confirmed that you have diabetes. So this is hyperglycemia if it is more than 6.4 or 6.5 in if you measure hemoglobin A1c, right? And you can also have less sugar than your body requires, your brains require. That is called hypoglycemia if it is less than 3.88, and if it is between 2.77 and 3.88, you won't get unconscious probably, but if you go below 2.77, then you may get unconscious, and that's why you should have an injection, glucagon injection means sugar in liquid form. So if some diabetic doesn't loses his or her conscious, then he or she should be injected, right? All right, so you understand, glucagon, that's a kind of injection, and it is necessary when someone gets unconscious because he can't have sugar. If you have problem with your cell, and if you measure diabetes and if it is less than 3.8, then you should have some sugar. But if you get unconscious, then you cannot have sugar. That's why glucagon injection is necessary. So why diabetes develops? Because you have a lot of radicals, free radicals. You may have destroyed. Suppose a bacteria gets killed, and the dead body of bacteria, if it goes inside the blood, if it mixes with blood, then it develops diabetes. And you can get rid of these if you have IAP, intestinal alkaline phosphatase 7 or plus, then you won't have diabetes even when you are fat, even when you have problem with your health system. So what you can do is you have curcumin, right? So you should avoid carbohydrates, that is carbs or sugar. You should have protein, not that much, but as much as it is necessary. So you can have 4 eggs. I usually have 4 eggs for kind of 4 years. And you can have meat, but that should be pasteurized chicken, or it should be pasteurized cow, bullock. And if you have the meat, that's better, right? Fish is fine, but nowadays you see a lot of contamination, a lot of uh, poisons paid, right? That's the problem. You can have lentils, so egg, meat, fish, lentils that have a lot of protein. So when you need muscle, what happens? 9 essential amino acids are necessary, but when you have blood sugar level high, you cannot do it. So 8 amino acid works, but one amino acid is missing. That's why you cannot have muscle, right, will not grow. It's all because of the sugar level is high. You should have a lot of fat that can give you energy. So basically carbohydrate gives you energy, but here if you can have fat metabolism, then fat will be burnt and energy will be produced. So it takes usually 2 to 3 days, 72 hours. Before that, it's really difficult for the body to understand that fat can be burnt and energy can be generated. It's something like you have meat in your freeze, but you are thinking you want to buy meat. You are not having meat, you cannot cook. So you have to understand that you have meat in your refrigerator. So the same thing happens here. The body is habituated of having carbohydrates, right? When you do not have carbohydrate, probably takes 72 hours or a little less, fat will be used as fuel, as energy, right? So fat will be metabolized. Something like CNG, you have a car that runs on petrol or diesel, but if you have CNG and if you have some mechanical attachment, what happens, your car can burn CNG and can run. Similarly, if you have fat, 75% fat, and if you have metabolism, right, fat metabolism, then what will happen? You can burn your, you can burn your fat. You may have deposited a lot of fat in your body. That's how the body works. Here you see when you have 6.1 or more, then your body starts damaging, a lot of health hazards develop. So it should be below 6.1. As long as you have blood sugar level 6.1 or more, it means your health damage is taking place. Your eyes, retina are compromised, blood pressure gets higher, and memory doesn't get much work. Dementia may develop in course of time after 65 years. This is a very common disease among people, those who have more than 65 years, right? They can develop dementia, and if the harder form, the worst form of dementia is Alzheimer's. So hearing is compromised, immunization is compromised, nerve damage takes place, amputation may be necessary, a lot of health hazards. So there's another kind of diabetes, that is gestational diabetes. If a woman is pregnant, after 3 months she may develop gestational diabetes. It is temporary. And the other kind of diabetes is inflammation. If you have a lot of inflammation, you may also have problem with metabolism. That's why the body is busy to fight with inflammation, the germs, viruses, bacteria. That's why the body doesn't work on sugar metabolism, and that's why at that time you may develop temporary diabetes. So what you should do is you should have no carbs, no sugar. You should have intermittent fasting more than 12 hours. I usually have intermittent fasting on an average 17 hours or 16 hours, right? So you should have 4 eggs, 2 eggs, 3 eggs, and that should be pasteurized, right? Nuts are good, especially walnuts, the best. The second best is almonds, but you can also have peanuts. So cucumber may help, salad may help, right? And you should have lemon water, apple cider vinegar. You should have cloves, you should have garlic for any inflammation, any bacteria, virus, right? Garlic can help you a lot, cinnamon can help you a lot. Ginger is very good for your gastritis. It can also develop your metabolic system better. So curcumin is very, very good. You see, if you smash turmeric, you have the powder of turmeric, that is curcumin. This can help you fight against cancer, fight against diabetes. That's it for now. Thanks for watching.